Hello and welcome back to my YouTube channel. In this video, we are going to talk about a topic which is very essential to know for every pathological resident in order to give a correct histopathological report. We are now going to talk about pigments of pathology. What are pigments? Pigments are any substance which occurs in a living matter that usually absorbs visible light. Now these pigments can be normally found in the body or they can be abnormal pigments. They can also be organic or inorganic pigments. Inorganic pigments are those which are usually insoluble. Pigments can be classified into three parts. One is endogenous pigments, the next is exogenous pigments, and the third is artifacts. Endogenous pigments are of three different types. One is hematogenous pigments, or also called as blood-derived pigments. The other is non-hematogenous pigments, and the third is endogenous minerals. Exogenous pigments are carbons, tattoos, silica and asbestos, and artifacts are formalin, malaria, schistosome, starch, mercury and chromic oxide. Now, isn't this list very extensive? We will now break down this classification one by one. We now start with hematogenous pigments. Hematogenous pigments can be further classified as hemosiderin, hemoglobin, bile pigment and porphyrin. We will now discuss about each of these pigments into a case-based study. Let us now discuss about the first case. So our first case, there is a 58-year-old male who presents with a history of heart failure. And these are his findings. Here, as you can see, there is some sort of a yellowish brown discoloration which is seen in his extremities. They decide to take a biopsy, and on H&E examination, these findings are noted. So as you can see here, there is some sort of a yellowish brown pigmentation, indicating that there is some sort of a pigment which is yellowish brown in color. Now to confirm this pigment, a certain stain is ordered and it shows these findings. So what is this pigment? This pigment is hemosiderin. So hemosiderin, as you can see, you have certain yellowish brown granules which are present, as you can see in this image. What is hemosiderin? Hemosiderin is a pigment which is nothing but aggregates of ferritin micelles. Now, how are these ferritin micelles formed? So hemosiderin, it usually contains iron which is in the form of ferric hydroxide. This ferric hydroxide is bound to apoferritin and which is then unmasked by various chemicals to form these aggregates of ferritin micelle. The condition that is described here is called hemosiderosis. Okay, so hemosiderosis has causes which are local as well as systemic. What is hemosiderosis? Hemosiderosis is nothing but excess of hemosiderin deposition. Hemosiderin deposition can be normal and pathological. Normally, it can occur due to aging, and pathologically, like I said, there are local causes as well as systemic causes. So locally, you can have due to bruise. Whenever a person gets bruised, there can be iron excess which can lead to hemosiderosis. Systemic, there is usually iron overload. Now pathologically, you can see it in conditions like chronic venous insufficiency, where there will be hemosiderin deposition in the skin, or it can be due to transfusion related diseases. So either chronic venous insufficiency or transfusion related disorders. The stain which is shown here is the Pearl's Prussian blue stain. So the stain that is shown here is Pearl's Prussian blue stain. So what happens in this Pearl's Prussian blue reaction? Basically, the ferric ion, it reacts with the ferric ion reacts with the dilute potassium ferrocyanide solution and that produces a insoluble blue compound, and this insoluble blue compound is called as the ferric ferrocyanide, which is also called as Pearl's Prussian blue. So this is about hemosiderin. The second case, a 65-year-old male presents with hematuria and oliguria. So hematuria is nothing but blood in the urine. Now particular casts are seen which are stained with leukoplatin blue V stain. Okay. So what are these casts? As you can see here, these casts are nothing but hemoglobin. Okay. So hemoglobin is a basic conjugated protein. As you can see here, this is a structure of hemoglobin. It is a basic conjugated protein. It has two parts. Okay. One, as you can see in this photo itself, this is a colorless protein which is called as the globin, and the next is a red component which is called as heme. There are two types of deposition when it comes to hemoglobin. The first is a physiological deposition. Now hemoglobin is deposited in the bone marrow, spleen and liver, and in the uterus. So in uterus, during menstruation, Hb from the breakdown of RBC, it is deposited in the endometrial tissue. Now this physiologically is or normally is found in the body. Pathologically, excess of hemoglobin can lead to three major conditions. One, as we discussed, is hemoglobinuria, or the presence of hemoglobin in urine. Now this is usually seen in hemolytic anemia and transfusion reaction. The next is hemoglobinopathies. Now these hemoglobinopathies can be genetic, wherein there is abnormalities in the structure or production of hemoglobin. Two major diseases are there, sickle cell anemia and thalassemia. The third is usually due to hemorrhage or hematomas. Now in hemorrhage or hematoma, what exactly happens is there is deposition of hemoglobin in the tissue outside of the blood vessels, which leads to tissue damage and inflammation. So Hb deposition is outside the blood vessel. Now hemoglobin demonstration happens through two major methods. One is enzymatic, another is tinctorial. So enzymatic method primarily relies upon the activity of the enzyme hemoglobin peroxidase. It relies upon the activity of this hemoglobin peroxidase, and this is a relatively stable enzyme. So based on this, we have the leukoplatin blue V method for hemoglobin. So as you can see, this is that leukoplatin blue V method, wherein the section from a kidney for a patient with hemoglobinuria stained for hemoglobin with the leukoplatin blue V method. The hemoglobin over here is stained blue. So here, as you can see, the nuclei will be in hemoglobin peroxidase method, the nuclei will be red in color and the HB peroxidase will be dark blue in color. The next is the tinctorial method. In tinctorial method, you basically stain the HB with specific dyes. Now in that you have the amido black technique for staining the HB. We now move on to case number 3. So in case number 3, a 40-year-old male with a history of alcoholism presents to the OPD with these values. As you can see here, the serum conjugated bilirubin is elevated 4.2 milligram per deciliter. SGPT is also elevated 300 units per liter, and the ALP or the alkaline phosphatase is also elevated, which is 500 units per liter. A liver biopsy is performed and it shows this sort of a yellowish pigment in the liver. What is this pigment which is highlighted? This pigment is the bile pigment. So bile pigment, it has 3 forms. One is bilirubin, the other is biliverdin, and the third is hematoidin. So how are these 3 different bile pigments are formed? So what happens is, there is a process. What happens is, these RBCs, they undergo a breakdown in the reticuloendothelial system, and that releases your hemoglobin. This hemoglobin, like we discussed before, has 2 parts. One is heme and the other is globin. Now what happens is, this heme component, it is metabolized and there is a tetrapyrrole ring which is formed. This tetrapyrrole ring is nothing but biliverdin. It opens a green color bile pigment which is called as biliverdin. So this biliverdin is subsequently reduced to form a yellow color pigment called as bilirubin. And this is bilirubin, which is highlighted over here. So biliverdin, like we said before, is green in color. Bilirubin is yellow in color. And what is hematoidin? Hematoidin is nothing but, it is a yellow-brown pigment found in old hemorrhagic areas. It is present in old hemorrhagic areas. This is usually observed in splenic infarcts and brain hemorrhage, which is old. What are the methods of demonstration of bile pigments? There are 3 methods of demonstration. The first is diazo method. So diazo method basically involves reaction between the bilirubin and diazotized sulfonylate acid. The next is the modified Foucher's method or the Hall's method. So here what happens is, there is conversion of the bile pigments into, so these bile pigments are converted into green color of biliverdin and cholecystine. This cholecystine is blue in color. So through the oxidative action of ferric chloride in the presence of trichloroacetic acid, this conversion happens. So what happens is ferric chloride oxidative action with trichloroacetic acid gives rise to this biliverdin and cholecyanide. So here, as you can see, the bile pigments are emerald to blue green. The muscle is yellow and the collagen is red in color. The third is a Mellin method, and in this Mellin method there is a spectrum of color change observed in the bile pigments. The bile pigments become yellow, then they become green, then they become blue, then they become purple, and they become red. This is about bile. We now talk about the fourth component, which is called as porphyrins. So porphyrins are actually organic compounds and they are usually involved in the heme synthesis because they serve as a precursor for the heme protein. So this porphyrin is actually a precursor for the heme protein. They are always present in small amounts, but whenever there is an abnormal accumulation of porphyrins, that would lead to a condition which is called as porphyrias. Porphyrias are of three types. One is acute porphyrias, the other is cutaneous porphyrias, and the third is hepatic porphyrias. So, in H&E, porphyrins will always appear as a dense dark brown pigment. Now, it is very important to detect this protoporphyrin in the UV light. This protoporphyrin appears as a Maltese cross appearance, as it is highlighted here. So, now that we have finished the hematogenous compounds, let us now move on to the non-hematogenous compounds. We will also talk about the non-hematogenous compounds in a case-based study. So, case 1, a 65-year-old woman undergoes a procedure to remove a suspicious mole in her arm. The biopsy results are as follows. So, as you can see here, there is a very dark brown or black pigment that is highlighted here. What is this black pigment which is highlighted? This black pigment is nothing but melanin, and the condition that I am talking about is melanoma. Melanin is normally found in the skin, eye, substantia nigra of the brain, and hair follicles. Abnormal accumulation of melanin is found in conditions which are called as benign nevus tumors and malignant melanoma. There are 5 ways to detect melanin. The first is reducing methods, second is enzyme method, third is bleaching, the fourth is fluorescent method, and the fifth is IHC or the immunohistochemistry. We now discuss each of these methods one by one. The first is reducing method. So, melanin by itself is a powerful reducing agent. Melanin by itself is a very powerful reducing agent. So, this reducing methods works on this property. Okay. So, the first is reduction of the ammoniacal silver solution to form metallic silver. And like I told you just now, it uses the property of the reducing agent of melanin to form metallic silver. And this method is used by the stain called as the Mason-Fontana stain. The next is a small method. So in small method, the melanin will basically reduce ferricyanide to ferrocyanide. Ferricyanide is reduced to ferrocyanide because of the reducing property of melanin. And this then produces Prussian blue, as you can see here, in the presence of ferric salts. So this is the Schmoll's reaction or the Schmoll's method. So as you can see here, the melanin is highlighted black in color and the nuclei will be red in color in case of reducing methods. In case of a Schmoll's method, the melanin will be dark blue in color and the nuclei will be red in color. So this is about the reducing method. The next is enzyme method. So enzyme method is where the cells which are capable of producing melanin, the cells which produce melanin are demonstrated by this DOPA method, which is dihydroxyphenylalanine method. So what happens in this is the enzyme tyrosinase, which is located in the cells, these cells have something called as the tyrosinase. Now this tyrosinase will oxidize DOPA or dihydroxyphenylalanine to form an insoluble brown-black pigment. So tyrosinase of the cells will oxidize the DOPA to form a brown-black pigment, and that will highlight the melanin. The third method is a bleaching method. So melanin is something which is insoluble in most of the solvents. This melanin is insoluble. So when you use strong oxidizing agents such as permanganate, chlorate, chromic acid, what will happen is that will bleach this melanin since it is insoluble. So melanin gets bleached due to oxidizing agents like permanganate, chlorate, chromic oxide, etc. So the method of choice for this will be using paracetic acid or treatment with 0.25% of potassium permanganate. The fourth method is fluorescence or formalin-induced fluorescence. So formalin-induced fluorescence is mainly for conditions like amelanotic melanoma. What will happen is there will be a yellow primary fluorescence, which is C. IHC or the immunohistochemistry. So here you have two major agents. The first is S100. So S100 is the gold standard antibody which remains expressed in the cells derived from the neural crest. HMB45, it usually demonstrates the melanosome formation. So this is how melanin cells stain for S100 and this is how they stain for the HMB45. We'll now move on to case number 2. So in case number 2, a 80-year-old female undergoes biopsy of the heart during autopsy. The H&E findings, they show this. So here you can see these are the myocytes and there is some sort of a pigment which is usually present here. This pigment is yellow to red brown. What is this pigment that I am talking about? The answer is lipofuscin pigment. So, lipofuscin pigment is usually produced by an oxidation process of lipids and lipoprotein. Whenever lipids and lipoprotein get oxidated, they produce this component called as lipofuscin. So lipofuscin is deposited pathologically in conditions like heart failure, age-related macular degeneration, liver failure, and Alzheimer's disease. So how do you demonstrate lipofuscin? You demonstrate lipofuscin by 5 methods. One is periodic acid shift or the pass. The next is Sudan black B. The third is Longzhi Mason. And the fourth is Mason Fontana silver. So the other exogenous pigments are chromaffin pigment. So chromaffin pigment, as you can see here, is highlighted over here. This is the chromaffin pigment. This pigment, chromaffin pigment, is normally found in cells of the adrenal medulla. It is a dark brown pigment and it can occur in condition which is called as pheochromocytoma. The next pigment is the Dubin-Johnson pigment. Dubin-Johnson pigment, it is found in liver. This is found in the liver and it occurs in patients with Dubin-Johnson syndrome. So this is a, as you can see here, it is a brownish black pigment. It is a brownish black intracellular pigment. And this is situated in the centrilobular hepatocyte. The third is a pseudomelanosis pigment. And the pseudomelanosis pigment is found in a condition called as melanosis coli. And this is seen in the macrophages of the lamina propria and of the large intestine and the appendix. It's seen in the macrophages of the lamina propria of large intestine and appendix, as it is highlighted over here. And it stains similar to lipofuscin. It is very similar to lipofuscin. We now discuss about the third and last component of endogenous pigments, which are also called as endogenous minerals. The first very important mineral that we'll discuss about is calcium. Calcium is usually found in very untraceable amounts in the body, but it is usually found in abnormal amounts in certain conditions like TB, infarction, where they are also called as gamma-Gandhi bodies, and they are also found in atheroma of blood vessel, and they are found in malakoplakia of the bladder. So in malakoplakia of bladder, they are called as Michaelis Guttman bodies. So as you can see here, abnormal deposits of calcium or calcification is highlighted here. So this calcium can be stained with a stain which is called as alizarin red, as it is seen here. And it can also be stained with something called as the von Posa stain. It's a very important stain. So how does alizarin red work? Alizarin red usually works by forming chelate complexes with calcium. and as you can see here, it is stained red in color. We'll now move on to the next very important mineral, which is called as copper. So, abnormal deposition of copper is found in a single most important disease, which is called as the Wilson disease. So, Wilson disease is nothing but a genetic disorder. What is Wilson disease? Wilson disease is a genetic disorder, and it usually occurs due to mutation of the ATP7B gene. So over here, you can see the liver biopsy of a patient with Wilson's disease, and this shows a macrovesicular steatosis. This is macrovesicular steatosis in a patient with Wilson disease. And this can be stained with the rhodamin stain. The rhodamin stain will highlight the copper which is present in Wilson disease, as you can see here. The third is uric acid or urate disease. The single most disease wherever the uric acid or urate is deposited pathologically is gout. So this is the histopathology of gout. So as you can see here, there are deep pink eosinophilic deposits that highlight gout. And this is then stained by gomorymethamine silver stain. This gomorymethamine silver stain will highlight the urate crystals, as you can see here. So this is part 1 of the pigments of pathology, wherein we discussed in detail about the different types of endogenous pigments and how they are highlighted, whatever stains are used for highlighting, and why is it important to identify and highlight these endogenous pigments. In part 2 of the video, we now discuss about exogenous pigments as well as certain artifacts. I hope you enjoyed this video. If you did, please like, share and subscribe to my YouTube channel. And as always, comments, healthy discussions are always welcome in the comment section below. Thank you.